Hey everyone, how's it going? Dr. Ty Hall here, coming at you from East Valley Chiropractic with our weekly video. Wanted to jump on here and talk to you guys today about a common condition that we see, and that is TMJD, or temporomandibular joint dysfunction, very classically known as TMJ issues. So I want to kind of just talk a little bit about this extremely common condition that we see here, and really first talk about what it is. So really, like I said, it's a dysfunction in the temporal mandibular joints where your jaw connects into your skull. How you know you have this are very common things that we hear from people, and how that they know that they have TMJD is that they have pain while they're chewing, or pain when they wake up in their jaw, or pain when they're opening their mouth, be it chewing or talking. Are very commonly, what you probably have heard before too, is clicking in that area when they move their jaw open and shut. Areas that are typically affected, the most commonly, there's a lot of muscles in the face here, muscles, what we call muscles of mastication, that are used when you're chewing or talking. Just a couple of those are temporalis muscle, lateral pterygoid, medial pterygoid, and the masseter muscle. Like I said, very commonly there is clicking in here, and where that comes from actually is the jaw and the disc. So there's actually a cartilaginous disc that sits between the jaw and the skull, and it's actually the lateral pterygoid that is connected to that disc. And so if you have tightness within that lateral pterygoid muscle that's found inside your mouth, that's going to pull that disc forward and cause that clicking when you open and shut your mouth. But very commonly, what a lot of people don't know, and how chiropractic can actually help TMJD or TMJ issues, is that there's a very common correlation with the cervical spine. The cervical spine obviously will have the nerves that control those muscles. And so if there's dysfunction within the cervical spine and irritation to the nerves to those muscles, then you're going to obviously very commonly experience those issues as well. But there's also some research that I want to go over with you guys. And this is research that's done by oral care providers that will help demonstrate the association between the cervical spine and TMJ issues. And we also have a fun little test that we're going to go over that I'll do with you. So the American Association for Dental Research, they recommend that if you have TMJD, or temporal mandibular joint dysfunction, it should be examined, not only the jaw itself, but also the head and the neck. And so this is why it's very important for professionals to work together, why we work with dentists and orthodontists in the areas, because there's no one better to evaluate the jaw or the mouth itself than a dentist or an orthodontist. But they don't spend their days evaluating the head and the neck. And that, like I said, it comes from the American Association for Dental Research, saying that the head and the neck region should also be examined. And who better than a chiropractor to do that examination? A couple other pieces of research. The Journal of Applied Oral Science says that cervical spine disorders actually can perpetuate factors for TMJD, or temporomandibular joint dysfunction. There's also, that internal derangement, or really the dysfunction within the joint, significantly is associated with the cervical spine, even, and this is very important, even without subjective neck pain. So even if you don't have pain, it's recommended that you still get this area examined, because there can be dysfunction within the cervical spine that's going to cause the pain in the jaw. And then I also want to do a fun, just little test quickly and briefly, just to show you the correlation between the functionality of the neck and how it affects your jaw joint, or your TMJ. And so simply what you're going to do is, just in a nice upright posture and looking straight ahead, you're just going to open and shut your jaw a couple of times. And I want you to notice that when you do that, how closely your teeth fit together. Okay, it should be extremely, extremely close, that they fit together. Now what I want you to do is look all the way up towards the ceiling and do the same thing. And you'll notice that when you do that, that your jaw actually slides posterior backwards, because you're looking up. Now, if you do the same thing looking forward, you're going to notice that the jaw slides forward. And why this is really important is because this shows you the correlation between the functionality of the neck and the functionality of the jaw. And what do we do as Americans? Most of the time, we spend our time looking down at the computer, studying for school, driving. We're always in this flexed position. And that's why it's really important to be evaluated not only your mouth and your jaw, but the head and neck as well. And what better person to do that than a chiropractor? If you guys have any questions, just leave us a comment in the section below. Reach out to us, 952-423-5050. Love to answer any questions that you have. Thank you so much, and we'll talk to you soon.